Okay, this video is, does bad teeth mean a bad brain, like cognitive decline or dementia? And I'm just going to tell you one of the things I do, I'm a neuroradiologist, so I've seen many tens of thousands of heads where I get these types of stories. Old guy fell, hit head, old guy on blood thinners, fell, hit head, old guy BHT, blunt head trauma, rule out bleed, old guy with memory problems, old guy with dementia, old guy with cognitive decline. But it's not always an old guy. I also see young guys with that history too, in their 40s, 50s. And so, anyways, Dice Clay, the comedian, has a rather vulgar joke about what it takes for him to be attracted to a woman. He says, two you know what, and a you know what, and a heartbeat, and I'm there. And I'm kind of kidding, but what I'm getting at is I look at a head. Let's say they gave me the wrong history. Let's say the only history I got was something like, sometimes they put the wrong history onto multiple films. They say, so let's say they gave me a history for the chest. Rule out pneumonia. That'll come on a head CT, a brain MRI sometimes. I can look at the case, and if I see the patient had bilateral cataract surgery and is a dentulous, has no teeth, I know it's a cognitive decline patient. I just can tell you, I've seen so many of them, that's almost like a reflex. Most of the cognitive decline patients are missing several teeth, if not all of them, and they've had cataract surgery on at least one side. They very often have both, and they usually are diabetic and hypertensive. Okay? So anyways, so here's two papers. First one is tooth loss in periodontitis patients, a risk factor for mild cognitive impairment, systematic review. And they go, yes, tooth loss is a sign of increased risk for cognitive decline in adults over 50 years. All right. Another paper, periodontal health, cognitive decline. Okay, long-term study, and yes, poor periodontal health and tooth loss appear to increase the risk of cognitive decline. I know it's true because I see it all the time. And the same thing, what causes cataracts? One of the big causes of cataracts is because they eat a lot of animal foods, especially a lot of milk, okay? And so that's also going to be associated with a lot of atherosclerosis. And the same patients, when they've got tooth loss, that's like leaky gums, because you're going to have increased permeability of the periodontal membranes, the soft tissue, your gums, and you can get bacterial endotoxins through there, just like you can get those through leaky gut. Then when you get the LPS, LTA, bacterial endotoxins causing the blood to be more thrombotic, amyloid clotting, we've talked about this before, then it's going to predispose you to cerebral atherosclerosis. In addition, if the guts are permeable, and the gut, you got leaky gut, increased intestinal permeability, and the mouth is increased permeable as well to bacterial endotoxins, there's a good chance you got blood-brain barrier increased permeability. They tend to go together, leaky gut and leaky blood-brain barrier. And then you can get endotoxins into the brain. You can get brain inflammation through the activation of the microglia by the bacterial endotoxins. All I'm saying is they usually go together. So what does this mean? It means take good care of your teeth. Okay, don't get me wrong. Everybody made some mistakes when they were young, had a cavity or two, and maybe got some of them filled, maybe had other dental problems. But do the best you can to take care of your teeth because they're like a warning. When you start losing teeth, or when you start having a cataract, that's a warning that, damage has happened to the brain and you better get your act together. The sooner the better. I can just tell you from a lot of experience, when I see a bad mouth, also like I talk to a patient, if they don't have any teeth, usually the first thing you think is this patient, didn't take care of their teeth. They're stupid. Okay, and don't get me wrong, sometimes they lose their teeth for bad luck, from trauma, for a lot of reasons, but they have to come out because it's part of cancer treatment for something else. I get all of that. Okay, but I'm just telling you, your teeth and your eyes are a warning sign, because I know a lot of people think cataracts are no big deal, losing teeth is no big deal, having dentures is no big deal. These are all debilitating findings on the path towards becoming demented. And so you should lock your heels in and start doing everything to prevent it, like we've talked about in so many of these other videos.